Good day, my dear postgraduate students. Welcome to the world of histology for pathology. What I shall be dealing with shall be the adipocyte, the fibroblast, and the collagen. In fact, these are done in two different sessions. You people must be wondering what this is. All men are equal before fish. Herbert Hoover. This quote I picked up for the fish technology. You can go either to my classes or to the text or net and find out what fish is. In the meantime, I shall continue with the class. Look at this. I am finding different shapes of cells. One is elongated and the long axis is this is the short axis. The nucleus is oval with the long axis parallel to the long axis of the cell. This is a fibroblast-like precursor. All these cells are mesenchymal or connective tissue cells. They can get converted from one to another if need arises. Now there is a gradual maturation. This fibroblast-like cell gets accumulated the fat droplets. And as they keep on getting accumulated, they can somewhat coalesce. Coalesce means joining together and they form a large vacuole. A large vacuole, and that is pushing the nucleus to the periphery. Whenever there is a nuclear vacuole, it has to be in the cytoplasm. Therefore, there will be a remnant of a cytoplasm that is there, which is a very thin ring-like, very difficult to identify. And dear students, you will not be able to see the cell membrane as easily as we draw in the record books. Look at this, for example, where is the membrane? Cannot make out. So there is a cytoplasm, there is a peripheral nucleus, and a large vacuolation within the cell. So this is called the adipocyte. I hope you people are able to describe this. Large vacuolated, what is the shape of the cell? A round cell with a peripherally pushed nucleus. And there is a rim of cytoplasm which can have the organelles. Usually we cannot see the organelles, but if they are increased in number, we will be finding them as fine dots or granular. We call it a granular cytoplasm. That is not probable in a case of a adipocyte. Look at this, for example, I am finding sheets of, look at the beautiful word. I would like you to use the word sheet. There are different terms used for arrangement of the cells. When it is 2 or 3 cells thick, we can use trabeculae. When it is finger-like projection, we can call it papillae. But in this case, it is sheets of cells, one adjoining the other. And when I look at it carefully, this is a relatively small cell when compared with this huge cell. So cells are of varying sizes, but they are predominantly round in outline. Forget the nucleus. Are you able to see a thin tint over here? That will be the cytoplasm, which we can say is almost indistinct. And the very thin line outside is the cell membrane. Then where is the nucleus? Look at this dot over here, which has been pushed to the periphery. This is the nucleus. There is a single nucleus, large vacuolated cytoplasm. And single vacuole is there because many vacuoles are joined together. So I hope you people are able to identify all these components. Sheets of mature adipocytes. Sometimes we will have to prove that it is fat. Why do you have this vacuolated cytoplasm? there is a process called as processing of the cell or the tissue. When it is put in alcohol, the alcohol will dissolve the fat. Therefore, they appear as empty spaces. In order to avoid this or to bypass this, we can do a frozen section. Frozen section is usually done for a rapid diagnosis, immediate diagnosis. But to demonstrate fat also, frozen section is done because there is no alcohol, therefore the fat is preserved. And I use a special stain. There are many special stains. This particular stain is called as Sudan 3. So the fat, it takes up a red color. It is easy for me to make a diagnosis. So this is a low power view showing vacuolated cells before the stain. This is a slightly high power view. Peripheral nucleus you people can make. This is another special stain called oil red wool. So all these are fat globules or vacuoles which have brilliantly taken up the oil red wool stain. Positive for fat. I would like you to describe. So what do you say? So it shows the tissue or whatsoever. Sheets of cells. The cells are large. They are round in outline. And they have got a vacuolated cytoplasm, pushing the nucleus to the periphery. And in some cells, I can see a thin rim of cytoplasm. Maybe in some areas, I can see a connective tissue. Look at this. This is a blood vessel. Probably there is a thin connective tissue that is supporting the entire. So this is another blood vessel over here. That is how you people should describe. Now, what is the difference? Here again, I am finding this sheets of cells, large vacuolated. Sometimes they are irregular because of the processing. Also, one cell tends to compress the other. But we will have to look at it in a majority. If you go to Africa, all the pygmies are short. One can be slightly taller than the other. So here I am finding vacuolated cytoplasm. But there is a difference. What am I seeing over here? This is a tumor. And on the surface of it, it is covered. Are you able to see some lines over here? These are blood vessels. That is how we make out a capsule. A capsule is a covering for a tumor or anything. That capsule is seen over here. Look at this band of thin collagen. That is a capsule. So when there is fat tissue with intact capsule, it becomes a tumor called lipoma. So lipoma is a benign tumor arising from the adipose tissue. Gracious.